Artificial Intelligence Dr. www.abcpharma.net/English. How does an increase in heart rate affect blood pressure? Cohere. An increase in heart rate can affect blood pressure in the following ways. 1. Increased cardiac output. When the heart rate increases, the heart pumps more blood per minute, leading to an increase in cardiac output. If the blood vessels remain at a constant diameter, this increased cardiac output will lead to a higher blood pressure. 2. Reduced diastolic filling time. As the heart rate increases, the time between contractions, diastole, decreases. This reduces the time available for the heart to fill with blood before the next contraction. If the heart doesn't fill completely, it may pump less blood with each contraction, which can cause a decrease in blood pressure. 3. Autonomic nervous system response. An increase in heart rate is often associated with activation of the sympathetic nervous system, which is part of the autonomic nervous system responsible for the fight or flight response. Sympathetic activation causes blood vessels to constrict, vasoconstriction, which increases peripheral resistance and leads to higher blood pressure. 4. Baroreceptor reflex. Baroreceptors are sensory receptors located in the blood vessels that detect changes in blood pressure. When blood pressure increases, baroreceptors send signals to the brain, which responds by decreasing the heart rate and dilating blood vessels to lower blood pressure. However, if the heart rate remains elevated due to other factors, this reflex may not be able to fully compensate, resulting in higher blood pressure. In healthy individuals, these mechanisms work together to maintain a relatively stable blood pressure despite changes in heart rate. However, in people with underlying cardiovascular conditions, such as hypertension or heart disease, an increased heart rate may lead to a more significant and sustained rise in blood pressure, which can have negative health consequences over time. It's important to note that the relationship between heart rate and blood pressure is complex and can be influenced by various factors, including age, fitness level, medications, and the presence of other health conditions.